Good afternoon, guys. I hope we're all sparkly. I've just come to clinic to clear emails before my trip to Alaska. Another Wim Hof expedition. Why another one? Because you've got to make sense of this crazy world, and the only way to make sense of a crazy world is to remove yourself every once in a while and get back to what? Nature. Understand how strong you are, how capable you are, and how resilient you are. And the world's stresses that are all crushing us are all an illusion. Embrace the cold, embrace your fear, overcome the sympathetic overload that happens as a result of overstimulation and oversaturation of nonsense with your parasympathetic nervous system. Breathe and cold water therapy. So, what have I done outside of clearing emails? I've been on the InBody 770 machine. This is a bioelectrical impedance scanner that our new patients go on to give them a benchmark, a baseline to work from, and they go on this every year to see what's happened. And normally, obviously, it's an increase in lean muscle mass, a decrease in visceral fat, a decrease in percentage body fat, and if it's not, they're in trouble. We are fans of tough love here at the Men's Health Clinic. So, get on it. Go earn your reward, because it's waiting for you. The InBody 770 is there. So, why did I go on the InBody 770? Well, I went on because I've done dry January. I've not had a drop of alcohol since New Year's Eve. Why? Am I an alcoholic? No, but I'm a habitual drinker. I cope with the stresses of the week by... Now, listen, I'm not alcohol dependent, obviously, but it's a regular Friday or Saturday just to calm down. And whilst it does work, it calms me down. I've deserved it. Have I deserved it? Have I deserved poisoning myself? How perverse is that? The temporary relief of stress, the temporary, here we are again. Done it a million times. What do I learn from it? Nothing. It's a place of safety. It's nice. And I do enjoy it. But not achieving anything. There's no real positive outcome apart from, here I am. Again. And I've suppressed consciousness. I've decreased my glutamate. I feel cool, calm and collected. Even more than just being on TRT. Because the premise behind TRT is to normalize your male androgen levels so that you can have a cool, considered response to a situation. But with life stresses coming at you, that can be quite troublesome. So booze is often used as a coping mechanism. I don't want to cope. I want to go forth and succeed. So we packed up the booze. The whole of Team TMHC packed up the booze for January. I've yet to see the results of everybody else, but my results are in. Firstly, how do I feel? I feel awesome. I feel actually sparkly. I have mental clarity. I have drive and determination. My motivation to get up off my arse and succeed has gone up. My confidence has gone up. I'm not a non-confident person. But what do? Fake it till you make it. There's no faking it now. I feel good. I do have negative thoughts come into my brain every once in a while, much like everybody. But now I'm batting them away with ease. As opposed to ruminating about things, now they're off. Skibaters, yeah? Not interested. Because negative thoughts will come into your brain. Because it's survival. And in our perverse world, negative thoughts can be seen as survival. But let's bat them away. Let's go out and what I'm going to say, earn your reward. So mentally, I feel in a much better place. Physically, how do I feel? Well, scores on the doors are in, and it's positive. I've been hitting the gym as usual. Pushed out, what was it, 135 today? Pretty good. Could have done more with the spotter, but I was on my Todd and I progressed up a little bit too gradually. But yeah, feeling strong, looking better in the mirror. Now, we don't place too much emphasis on weight because obviously muscle weighs more than fat, but I'm looking better and I'm feeling better. So is that enough? Well, let's look at the quantitative markers. So I've been tracking my health with my Whoop strap, which I love. It gives a level of accountability that we all need. I'm no longer okay with being okay. I want to be optimal again. So the Whoop strap has actually been very good. It's highlighted, well, it told me I shouldn't be drinking because my heart rate variability dropped and my resting heart rate went up because I had bad sleep and my sympathetic drive increased as a result of glutamate. So since stopping booze, my heart rate variability is higher. My resting heart rate is lower. It's a win-win. Happy days. Confirmation that I've made the right decision. So the in-body 770, my score pre-January was 95. It isn't bad, to be fair, but I know I could be better. So what is it now? In only 4 weeks, it is now 98. So you gain points for muscle mass and you decrease points for fat. So rather disappointingly, New Year's, my body fat was 18%. Shock horror, naughty doc. Sort yourself out, mate. So I have. So outside of packing up the booze, I've also gone to 1 meal a day. And I feel alive. I feel alert. And I'm loving it. If I have a pang of hunger, I bat it away. Again, the booze, packing up the booze has helped. Not only do you not make bad choices, you can bat away those hunger pangs with ease. It's actually been really easy to make the right choices. So it's never just one thing, is it? It's always a few things. Which is why it's hard to say, well, if you just do this, you will achieve this. But life is a snowball effect, has a snowball effect. So it's testosterone, sort your sleep out, sort your stress out, sort your nutrition out, sort your exercise out. You've got to do all of these things to succeed. And how often are you going to do it? Yeah, every day. Your male androgen profile works anabolic nighttime, catabolic daytime, recovering from the day to prepare for the next day. Every day is a new opportunity to be a better version of yourself. So get on with it. So my percentage body fat has gone down from 18 to 16%. Still room for improvement, and I'm going to improve. But 2% body fat loss is pretty good. My target weight has gone up. My lean muscle mass has gone up. My metabolic rate has obviously gone up, which is wonderful. And instead of having to lose 3.1 kilos, I now only have to lose 1.1 kilos. Pretty good, but there's still work to be done. And guess what? I'm going to put the work in, because I want to be a lean, mean fighting machine again. I want to earn my reward, and I want to lead by example, practice what I preach, so I can be a good example for myself and for you. Because sharing is caring. What else? Visceral fat's gone down. So visceral fat is the fat that surrounds your organs. So that's wonderful, because that's more of a cardiovascular risk factor than percentage body fat. So where do we go from here? Exactly. Where do we go from here? Let's keep moving forwards. Let's do dry February, March, April, May, June. June, I'm going to Le Mans with the lads. I want to have the conversation with myself. This conversation is going to go like this. Rather than Le Mans, beers and barbecue, obviously I'm going to drink. I want to have the conversation. Shall I have a drink? And decide there. Might not. Might do. We'll see. Life's all about opportunities, not threats. Seeing things, seeing challenges as opportunities. Healthy hormone levels serves as the foundation, as I've said before. How you react is down to your autonomic nervous system, and we've said before, work on the parasympathetic nervous system, breath work, ice cold therapy, mindfulness, and also work on this. What do you want to do? What's your brain saying to you? Are you okay with being okay? Or do you want to be, terrible cliche, the best version of yourself? I heard on a podcast of Joe Rogan, true hell is meeting your optimal self and seeing what you could have achieved. So what am I going to say next? Yeah, you guessed it. Go earn your reward.